You know, every new medicine, every single life-saving treatment we have, it all starts with a clinical trial. But behind all that amazing science, there's a fundamental promise we make to the volunteers who make it all possible, a promise to protect them. So, how do we balance that incredible push for progress with the absolute non-negotiable need to protect every single person? Well, that's what we're diving into today, the essential ethical guidelines that are the absolute bedrock of modern medicine.
Okay, so let's just start with the biggest question of all. How do we test new medicines on people and do it safely? I mean, think about it. It's a constant balancing act, right? We desperately need scientific progress, but our number one duty, always, is to protect the individuals who make that progress possible.
And the answer to that huge question really lies in this dual goal. On one hand, you've got the drive to advance knowledge for the good of all of us, for society. But on the other hand, and this side is completely non-negotiable, is the duty to protect the rights, the safety, and the well-being of every single participant. Ethical guidelines are the framework that's designed to keep these two things in perfect balance.
Now, to make all of this work, the entire system of modern research ethics is built on a foundation of just 3 core principles. Think of these as the guiding stars for every single decision made in a clinical study. They're the bedrock. Let's break them down.
First up is respect for persons. Now, at its heart, this is all about autonomy. It's recognizing that every single one of us has the right to make our own choices. This is the entire foundation for what we call informed consent, where a potential participant gets all the facts, the good, the bad, the unknowns, and decides for themselves, completely free from any pressure. It also means we have a special duty to provide extra protection for those who might have diminished autonomy, like kids or people with cognitive impairments.
Next, we have beneficence. You can kind of think of this as the do no harm principle, but honestly, it's way more active than that. It's a real obligation for researchers to constantly be weighing the scales. They have to design their studies to maximize the potential good that can come out of it, while at the same time obsessively working to minimize every single possible risk to the people involved. It's a continuous risk-benefit assessment, not a one-and-done thing.
And our third core principle is justice. This one is all about fairness. You gotta ask the question, who bears the risks of research and who gets to enjoy the rewards? Justice says that the selection of participants has to be equitable. We can't just choose a group of people because they're vulnerable or because it's convenient. The whole point is to prevent any kind of exploitation and to make sure that the incredible fruits of scientific labor can truly benefit everyone in society.
So, there we have it, our 3 core principles: respect, beneficence, and justice. But how do we take these big ideas and actually put them into practice? Well, they form the basis for a whole set of practical, real-world rules that guide every single study. We can actually group them into 3 main areas. Let's start with the rules that are all about protecting the participant.
All right, first up, the rules centered on the participant. It all begins with informed consent. Your participation has to be 100% voluntary, and you have the right to withdraw at any time, for any reason, no questions asked. Next is non-exploitation. Researchers cannot, under any circumstances, take advantage of a person's socioeconomic situation or any other vulnerability. Your privacy is also totally paramount, with super strict rules on keeping your personal data confidential and secure. And finally, and this is so critical, is risk minimization. Every study has to be designed to reduce potential harm to the absolute minimum. These aren't suggestions, by the way. They are fundamental rights.
Okay, next up are the rules for the researchers and the whole process itself. The study has to be essential. It has to be answering a question that can't be figured out any other way. The research team must have proven professional competence. I mean, these folks need to be experts in their field. The entire process demands accountability and transparency, which means everything is documented honestly and openly. And the institution where the research is happening, they have their own responsibilities, making sure there's proper oversight and that all the resources are in place to support the studies safely.
And finally, we have the system-wide rules. Distributive justice means the benefits of research should be aimed at helping all of humankind, not just a few privileged groups. The knowledge that's gained isn't meant to be locked away in a vault. The results should be made public to drive science forward for everyone. And this is a big one. Responsibility is shared. It's not just on the lead scientist, the sponsors, the monitors, the institution. Everyone is on the hook. And of course, compliance with every single rule all the time is mandatory for every single person involved.
Whew! That's a lot of principles and rules, right? Which leads to a really important question. Who is actually making sure all of this happens? Who are the guardians standing between the research and the participant, making sure all these rules are followed? The answer is the Ethics Review Board, or you'll often hear it called the IRB. You can think of them as the independent watchdog.
This committee's entire job is to review research proposals before a single person is ever enrolled, and then to monitor those studies as they go. Their one and only mission is to be the advocate for the participant, to protect their rights, their safety, and their well-being above absolutely everything else.
Now, what's really cool is who actually makes up this board. This isn't just a room full of scientists. To make sure there's a really balanced review, an IRB has a super diverse group of people. Medical experts, of course, but also a legal expert, a social scientist, and critically, a layperson, someone from the community who represents the public's perspective. The chairperson even comes from outside the institution to guarantee impartiality. This diversity is honestly its greatest strength. It makes sure every study gets examined from every possible angle.
So these principles and these boards, they provide a really powerful framework for today. But science doesn't stand still, does it? As we rocket into an era of AI-driven drug discovery, massive datasets, and revolutionary tech like gene editing, the ethical landscape is constantly shifting. And that leaves us with a final, crucial question to think about. What new ethical questions are we going to have to answer next to make sure that progress and protection always go hand in hand?